Understanding Medicare in 20 minutes. First thing is first, you need to sign up for Medicare Part A and Part B. You sign up for Medicare through Social Security. If you are new to Medicare, like turning age 65, you can sign up online at the Social Security website, which is ssa.gov. When you do sign up for Medicare, there usually is no cost for Part A. For Part B, most people will pay the standard $185 per month. This cost could be higher for people that have high incomes. The cost will come out of your Social Security check if you're getting it. If you're not, they will bill you quarterly, but you can change it to monthly if you like. After you sign up for Medicare, you will get an ID card, as shown in the slide. This card will include your Medicare ID number, which you will need in order to enroll into a Medicare plan or supplement. Under Original Medicare, which means you have not enrolled in any other Medicare plan or supplement, you just have your Part A, which covers hospital costs, and Part B, which covers outpatient expenses such as office visits, labs, outpatient surgery, diagnostic tests, chemo, etc., things like that. If you stayed just on Original Medicare and did not enroll into any other Medicare plan or supplement, you will pay the hospital deductible, which is close to $1,700 when you're hospitalized. And for outpatient expenses, you would pay an annual deductible of $257. And then after that, you would pay 20% of the expenses with no cap or maximum. For example, if you needed chemotherapy, you would pay 20% no matter what the cost is. And it would not stop. There would be no cap on that. Obviously, this can add up to some big numbers. So what do you do to cover the risk and protect yourself? As you can see, Original Medicare is not enough. To protect yourself from high medical bills, you should either purchase a Medicare supplement or enroll into a Medicare Advantage program. I like to refer to these as option 1 and option 2. Let's look at option 1. Option 1, you would buy a Medicare supplement, Plan G, which is simply an insurance policy that will pay for the Part A deductible, hospital deductible, and it'll pay the Part B outpatient coinsurance, which is the 20% that you would be responsible to pay for. Under the Plan G Medicare supplement, you will pay the Part B deductible, which is $257. After that, your covered medical bills would be paid 100% the rest of the year. So between Original Medicare and your supplement Plan G, your only responsibility would be the $257. However, you do pay a monthly premium for the Medicare supplement, and it does increase the price as you get older. So for example, let's look at a 65-year-old. Their average cost, depending on some factors, which we'll get into, but the average cost could be $140 per month all the way up to $250 per month. This will depend on where they live, on what insurance company they buy the policy from, because they do vary, and of course age would factor in as they get older. Keep in mind, there is no outpatient prescription coverage under Original Medicare, and your supplement, the Medicare supplement, also does not cover outpatient prescriptions. In order to get coverage for prescriptions, you would purchase a Part D drug card or prescription card. This is offered through private companies, and it is partially funded by Medicare, which helps keeps the cost down for you. With Part D or a Part D drug card, you will pay a portion of the cost of your drugs, like either a flat copay amount, or some cards will have a percentage of the drug cost that you will pay. So for example, if it's $100 for the drug and they have a 20% coinsurance, you'll pay $20 then for it. You will notice that most common generic drugs are no cost to you, or they have a very small copay like $5. Brand name drugs and some generics, some expensive generics, will have a higher copay and or coinsurance where you pay that percentage of the drug costs. Most Part D drug cards that are available today have an upfront annual deductible, which can be as high as $590 for the year. The deductible usually is for brand name drugs or expensive generic drugs, specialty drugs, but it does not apply to your common generic drugs that most people take. Just like the Medicare supplement, there is a monthly cost or premium for the prescription Part D plan. Currently, premiums range from $15 to $100 or even more per month. Not only do Part D drug cards vary in cost, but they also vary in what drugs they cover. That's why when you're shopping, it's very important to find out, and when you're shopping, to make sure that the drug card you're looking at covers your prescriptions. If you do not enroll in a drug card, a Part D drug card, when you are first eligible for Medicare, then you can get a lifetime penalty that will grow the longer you don't have a drug card. So the longer you go past age 65, the higher your penalty will be when you do get a drug card. This can be eliminated if you have employer coverage. So say you're working past 65, you have drug coverage through your work. Even if you're 67 and you go to Social Security, sign up for Medicare, they'll ask for proof that you had coverage, and then that would eliminate any penalty. In summary, option 1 would cost you monthly your Part B premium, which could be the $185 commonly, or could be higher if you have a very high income. You will pay the Medicare supplement premium, which again, varies on a lot of different things. It could be $140 a month. It could be, $250 a month. It just depends. And you would also pay the cost of Part D, which is the prescription card. So when you really add it all up, if you just take the averages, you're looking at about $375 a month on average. Could be higher, might be a little lower. Under option 1, you would not have coverage for dental, vision, or hearing aids, or any other extra things like gym memberships and things like that. It is important to know that Medicare supplement rates will increase annually as you get older. Also, the Part D premiums will change from year to year. They too most likely will be going up every year in the future as well because of the cost of drugs. Let's look at option 2. Under option 2, you would enroll in a Medicare Advantage plan. What that does is it takes Medicare Part A, Part B, which is the outpatient care, and Part D, the drugs, and it rolls it all together into one Medicare plan for you. Medicare Advantage plans are offered and managed through private healthcare companies such as United Healthcare, Humana, Cigna, etc. But they are funded and ruled by Medicare. Most Medicare Advantage plans have no monthly cost. Medicare Advantage plans include coverage for your medical expenses, inpatient and outpatient, prescription drug costs. They also provide extra benefits like dental, vision, hearing aids, and a gym membership. If you do enroll into a Medicare Advantage plan, you are still required to pay the Part B Medicare premium, which again is currently the $185 a month. Unlike option 1, where you pay a monthly premium and have very little out of pocket for medical care, with a Medicare Advantage plan, you pay a flat copay for only the services you use. You will see in this slide an example of what a typical Medicare Advantage plan looks like. You can see 0 monthly costs. There is no cost to see a primary care doctor. There usually is a $25 specialist copay to see a specialist. And remember, the copay is the part that you pay. Only what you pay. $40 copay for urgent care. There's no cost for wellness care or preventative care. There's no cost for labs usually. If you go to the emergency room, you pay $140 or less, depending on the plan. And all plans cover you worldwide for emergencies. So you don't have to worry if you're in a different state or even out of the country. You can see how you would pay $200, a $200 copay for outpatient MRI or a CAT scan. That would be your total cost. $295 copay to get an outpatient surgery. And it's important to understand that $295 copay covers the whole surgery. So there is no additional cost for you. It includes the doctor, the room, and all that. If you're hospitalized, you pay $295 a day under this particular example, $295 per day for the first 5 days. So if you were in 2 days, you would pay $295 and $295. And then that would be it. So maybe you had a surgery for your knee and you were hospitalized for 2 days. That would be the whole cost of your surgery. And again, that is all inclusive. It includes the surgeries or any testing or doctors or anything like that. Most plans, well, basically all plans, have a maximum out of pocket of $4,000 to $4,500. Some have less, some have more. It just depends. But it's not a deductible. It's a copay maximum. So that means if you only do a few things for the year, maybe see a specialist, maybe go to the ER, that's all you're paying for the year is that copay that you spent. So if you have nothing going on, then you spend nothing for the year. The Part D prescription coverage that we did review in option 1 is the same card, but it's built in to the Medicare Advantage plan. So there's no need to purchase an extra drug plan. It's already included in your Medicare Advantage program. This is the same type of coverage you would have if you had to buy the standalone one, the one that we did review. However, you will notice most plans, the prescription Part D drug coverage included in the Medicare Advantage plans may have no deductible or a lower one like $200 or $350. Some do have the highest deductible, which is the $590. I did forget to mention under option 1, the Part D drug program, no matter if it's in the Medicare Advantage plan or you're buying it standalone, does have a maximum out of pocket of $2,000. So whether you're paying a deductible or a percentage of your drugs or whatever, the most you can pay in 1 year is $2,000. And then your drugs will be covered 100%. You can see under the Medicare Advantage plans, they do include the additional benefits like vision exams are free. They give you an eyewear allowance, which usually is $200 to $400 a year. They give you a dental program. Some just cover cleaning, some cover comprehensive care like crowns and cleanings, things like that. And they have different limits. Some will pay up to $1,500, some will pay up to $3,000, some will even pay higher than that. They do usually, almost all of them include a gym membership, which is that silver sneakers or another program. And they all include hearing aid coverage. And some of them used to, and they do include now, some include money where they give you money to buy things quarterly over the counter, like health related items. Other important information regarding Medicare Advantage plans, they do have a list of providers that you need to see. They come in 2 different types of programs. You can either have an HMO where you have to stay within the network, or you can get a PPO where you can go in and out of the network. Usually with an HMO, they have very extensive networks. So most of the time, your doctors are going to be covered, and hospitals are going to be covered, and they're very good at the coverage on within the HMOs. Most of them don't need referrals anymore. And it's a lot different than what you might think from years past. Some national plans, as an HMO, like United Healthcare or Aetna, you can go to Florida or be in Ohio or be wherever you want to be, and you can get treatment because they have providers all over, usually in all 50 states. So if you need just a non-emergency surgery, you can do that somewhere else in a different area, even though it's an HMO, but you're just using the United Healthcare provider or Aetna or whatever plan you're on. The PPO plan, you can go in or out of network. However, it does cost more to go out of network. So usually people don't even go out of network. I mean, unless they just absolutely have to for some reason, a certain surgery at a certain hospital in some certain state, but it usually rarely ever happens. Prescription deductibles, that's important. They're different under the Medicare Advantage plans, but you need to know what the amounts are. What drugs are covered, that there's a difference in that between plans, so that's important to understand and know, as well as the cost of the drugs can vary per plan. So one plan may have a brand name drug under a tier 3, which might be, I'm making this up, $45 a month, and another plan may have it at a tier 4, which is $100 a month. So those are things that you have to be aware of. Dental plans that are included in these programs, they have networks as well. Some don't have a network. It just varies, but it is important to make sure if your dentist is covered or not covered. All the other additional benefits like vision, hearing aids, and all that, same thing. That will differ plan to plan. This is why it is very important if you to make sure the plan that you enroll into covers your doctors, your hospitals, your dentist, your vision provider, and of course, importantly, the prescriptions that you take. In review, option one, which is where you would buy a Medicare supplement and a Part D drug card. You will pay a monthly premium for the supplement and the drug card. You will have little out of pocket for medical care, and you can see any doctor or provider that you want. The downside to option one would be the rates do go up annually. That's the biggest problem. Option two is when you would enroll into a Medicare Advantage plan. There's no monthly cost for most plans. Some will have a small premium like $19. You pay a flat copay for services that you use, like $25 to see a specialist. You use providers that are part of their network. In general, plan networks, as I said, cover most providers in your area. Medicare Advantage plans include additional benefits that option one does not, like dental, vision, hearing aids, gym memberships, etc. So those are your differences. And this is why I created Medicare Plan Match. We do all the work for you. Our process is simple. You complete our online Medicare information form. It provides us with your doctor names, your dentist name, medication names. Then we shop the plans in your area and come back to you with a program that'll match or fit your needs. We will review the plan with you and sign you up if that's what you would like. We handle everything for you. Plus, you get ongoing support throughout the year. Thank you for listening.